All right, good morning. I'd like to welcome everyone to the fourth installment in our Child Health in the 83rd Texas Legislature webinar series, Are Complete Streets Good for the Public Health of Texas? My name is Brooks Ballard, and I'm with the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health, Austin Regional Campus. And we're very excited about today's webinar, but before we get started, I'd just like to take care of a little housekeeping. First of all, our webinar today is being recorded, and an archive will be made available on the MSD Center website in the coming days here. That's www.msdcenter.org, along with a PDF of the presentation slides. During today's webinar, we encourage you to ask questions via the chat box, which you can access through the control panel at the top of your screen. You can type in your questions at any time, but to keep us on schedule, we'll try to hold off on answering them until the Q&A portion at the end of the presentation. When typing your questions into the chat box, be sure to select the option to send your message to all attendees. Next, I'd like to let you know a little bit about the Michael and Susan Dell Center for Healthy Living. Okay, we're an international leader in conducting research and providing programs that promote healthy living for children, their families, and communities. Our work fosters improved health behaviors among youth, influences policy and environmental change to support healthy living, and advances professional education and community service. Our vision is healthy children in a healthy world. You can find out more about our center and our work on our website at www.msdcenter.org. And one project in particular that I think might be of interest to our participants in today's webinar is the TCOPE project, the Texas Childhood Obesity Prevention Policy Evaluation Project. This project is evaluating various components or implementations of the Safe Routes to School program and a rule change to the WIC program to measure their impact on health and determine best practices. They're also in the middle of conducting a survey of Texas legislators to assess their public health knowledge, attitudes, and health beliefs. To learn more about this project, you can visit tcope.org. Now, I'm very delighted to introduce our distinguished guests for today's webinar. We have Robin Stallings, the Executive Director for Bike Texas. Robin's been Executive Director of Bike Texas since 2003, previously managing the legislative programs from 1999 to 2003 as a volunteer. Robin served as chair of the TxDOT Bicycle Advisory Committee and is active in Vision Central Texas, the Safe Routes to School National Partnership, and was a founding board member of the Institute for Transportation and Development Policy. Robin is a League certified instructor and holds a BA in Middle Eastern Studies from the University of Texas at Austin. Our other speaker is Dr. Bill Cole. And Dr. Cole is a professor of epidemiology with the Michael and Susan Dell Center for Healthy Living at the UT School of Public Health, Austin Regional Campus, and the Department of Kinesiology and Health Education at the University of Texas at Austin. Dr. Cole is an international leader in the area of physical activity and health. He's a fellow of the National Academy of Kinesiology and was recently named to the President's Council on Fitness, Sports, and Nutrition Science Board. Well, gentlemen, I'll hand it over to you, and thank you so much for joining us today.
Brooks, I really appreciate it. Complete street means something different no matter, depending on where it's located, whether urban, rural, small town, and so this gives a bit of a definition. But the basic idea is that the street is complete when every user is safely accommodated. And so that's the measure. And I'm going to give some quick slides to give you all an idea of what that can look like. Here's a good example of a complete street that's converted with a traffic circle. One thing that's important to note is both of these roads still move 25,000 cars a day. So there's not necessarily a sacrifice to doing a complete street. Frequently, everything is in the plus column, whether it's traffic congestion or other benefits that we'll talk about later. Here's an example of a green lane crossing, and this is in Chicago. In Montreal, they have a two-way cycle tracks, and that's a protected, separated facility that is really catching on around Texas, but particularly in other places, New York, Chicago, Portland, and those, in many places, a cycle track becomes part of a complete street. Other places, it's something more separated like this, or just basically bike lanes, or with this extra margin of comfort, they're sometimes called a buffered bike lane. And here's another example And then in the rural areas, this is really nice when you can do it separated, but this is more typical. If there's indications are that there aren't going to be pedestrian traffic for a very, very long time, sometimes an extra wide shoulder is enough. And sometimes it has to do with the appropriate seal coat or rumble strip, so whether or not the tires can handle it. Then here's another example of a small town, kind of a main street approach, where if the traffic's slow enough, frequently you can blend the bikes and cars without any problem. It's always important to remember pedestrians because we're all pedestrians just about every day. So, thank you.
Robin, thanks. This is Phil Cole. One of the key things that we're obviously interested in is the health effects of what these complete streets might do. They certainly have potential environmental effects and likely economic effects as well. I think that you're going to talk about a little bit later. But a key question always becomes, are there health benefits to a individual or a set of individuals or to a population in designing complete streets? And I think the logic train that you have to go through to answer this question starts with physical activity. We know that physical activity, particularly at a level that is at a minimum of 150 minutes of moderate intensity activity a week, or 75 minutes of vigorous intensity activity a week, improves health. And if you're there, it maintains your health. We know that more is better. We know that that's a kind of a minimum right now, and based on existing evidence-based guidelines, I think that's a critical point to be thinking about, and how complete streets movements and complete streets efforts can support health benefits in a community. So if you accept that as an assumption, clearly one of the key reasons complete streets are of interest is active transportation, not only for physical activity and other things, but pollution reduction, traffic reduction, improved quality of life, and all these other kind of things that we think are associated with active commuting. The logical train there is that active transport, or walking or bicycling to and from destinations, or skateboarding, or even electrical bicycling, actually improves physical activity. We're pretty sure about that. The evidence is pretty clear that if you are actually actively commuting or moving between destinations, your physical activity levels and the physical activity levels of a population increase. Where we kind of are just now in the emerging set of evidence is the direct evidence that active transportation has on health and health outcomes. You think it's a logical statement to make that that the people who are actively commuting actually have a lower risk of disease states, better risk factor profiles, and so forth for non-communicable diseases. But we have limited information. It's unfortunate that we're just now getting around to understanding some of these things, because I do believe that more studies that focus on the health and health-related impacts specifically of active transportation will be of interest to this movement, I think. And as Robin said, complete streets are designed to increase access and safety for all types of active transportation, cars included. This is a recent study that I wanted to point out for the participants today. It was published in the American Journal of Preventive Medicine just at the end of last year, and it's one of the few nationally representative studies that we have that actually provides some health and health outcomes. In this particular case, using a couple of cycles of the National Health and Nutrition Examination Survey, the authors took a look and classified people by their levels of active transportation, whether they were or were not actively transporting. And they actually categorized it into low active transport, high active transport, and no active transport. In fact, these authors found that the odds, for example, of having hypertension if you were actively commuting were 24% lower than if you were not. diabetes particularly was a significantly lower prevalence compared with in those who were actively transporting versus those who did not. It's a cross-sectional study, but I think it's and it has obviously its limitations. But one of the key things that this study allows is it isolates physical activity for active transport rather than overall physical activity, such as you'd get in leisure or other kinds of household or things like that, other kinds of modes, and isolates it specifically, as I said earlier, one of the first to really show us an association with health outcomes, not just that people who are actively transporting are more physically active, which there's quite a bit of evidence on. Now we're kind of evolving to health outcomes, and I think this is a big step forward. So we've got lots of different examples. Robin is the expert in this. I'm not going to particularly talk about these kind of things, but I want to call attention of the design strategies and so forth. I did want to call attention to a couple of kind of key things that from a what to do standpoint on this that we should be thinking about, I believe. And again, I'm all about advancing the science in this particular area. The Guide to Community Preventive Services Task Force strongly recommends environmental and policy approaches for physical activity promotion. And these are kind of key environmental changes. They aren't just behavioral changes. Well, why don't you just go get a bicycle and be more physically active? Well, if there's no complete streets or there's no protected bike lane or even a marked bike lane, it becomes much, much more difficult for people to try to do. So in the past some years, we've been really advancing our understanding on these environment and policy approaches that work to increase physical activity. And one of the key recommendations here is street scale and urban scale design and land use practices, of which complete streets, bicycle lanes, and such, I think are kind of a critical piece to talk about. We know that active commuting has changed over time. We know there have been dramatic drops in, for example, walking and biking to school over time. This is a paper we published some years ago that took a look essentially the percentage of students who walked or biked any distance between 1969 and 2001 to and or from school decreased from 42% of students to just over 16% using National Household Transportation Survey data. Just a remarkable decline, and we have to do something to reverse this, I think. Here are the data stratified by the distance from which the students reported living from school. So in other words, those who lived less than a mile to 1.9 miles, 2 to 2.9 miles, and greater than 3 miles. And in each mode of transportation, you see drastic changes over time. This is since I was in school and I used to walk to school. But even among those who lived less than a mile from school, there was a more than 23% drop in the percentage of people who walked or biked less than a mile to school. They sought something other than active transportation. Similar decreases for 1 to 2 miles, 2 to 3 miles, and so forth. And what's remarkable about this also is even the school bus, even the transport to school bus over time has been dropping, particularly among those who live more than 3 miles. We've got a dramatic shift to an automobile-centric way of getting kids to and from school between 1969 and 2000. And I have to think that attempts for complete streets, attempts to build the infrastructure and the environmental supports that help people become more physically active can be used to address this problem. Some other data that I'll call attention to. This is a recent publication taking a look at extending what we did in the children to adults. Again, using not the 1969 data, but the two most recent waves of the National Household Transportation National Household Travel Survey for adults, taking a look at changes in walking trips and cycling trips and so forth in the U.S., what's going on in the U.S. And I think there's a bit of good news here that we may have hit bottom or we may be on the way up. For example, the authors specifically reported that between these time periods there was a 17.2% increase in the total walking trips per capita per year in the United States, and a 17.2% increase. And cycling was a lot less of a change. Obviously, most of the change was due to the change in walking trips, but there was evidence of almost a 20% increase in the percent of trips taken and could be classified as being by active travel over that period of time. I think this is reasonably good news. At least it's not going down any further in adults. And I think it points to an opportunity, some of the things like Robin and the group at Bike Texas are doing to help us understand how to get these environmental changes in place for improving physical activity. These are just some data that take a look further from that study, that take a look at the recommendation of 30 minutes, or kind of a cut point categorization of 30 minutes of walking or cycling, and point this out here. Over time, there was an increase of nationwide in the U.S. from these data, an increase of just under 0.8% for 30 minutes of walking due to active transport. It was really an unmeasurable change, or a difference, if you will, from 2001 to 2009 in the cycling category. Part of that may be measurement artifact, but I have to believe that changes in complete streets and efforts to change the environment will be able to move this needle a little bit more. And finally, of interest, I think, for those interested in policies, this is a paper that was just published last week in the Journal of Public Health Management and Practice that takes a look at policies that support the kind of work that Robin and Bike Texas do to actually try to get local and state support for the built environment for complete streets, particularly across the U.S., following in line that they will increase physical activity and therefore improve health of participants. Some interesting graphs here. This is an interesting geospatial change from 2000. The black dots indicate cities with complete street policies. That looks like Boulder and somewhere in Southern California. I forget which one they isolated. And a few states that do have some noticeable or some measurable policies. If we do a kind of a map evolution over time, it's starting to expand. At least in the U.S., it seems that counties and or municipalities, as well as states, are starting to put more attention to this. And I do believe that what we see here, this measurement of these changes, will result in some positive changes in these commuting data. This is 2000, 2005, and then I've graphed 2005 here again in 2008. You can see the progression. I think that that's a very reasonable and encouraging sign that the more upstream effects of that people know that can influence public health and policy around complete streets are actually increasing in their prevalence. And I think understanding how those policies have come to pass, how they got put together, and what the lessons learned for other cities might be able to be is extremely helpful.
There are so many different benefits to complete streets and facilitating active transportation. And I think that public health is probably the top in my mind. What we're going to save in healthcare, what individuals are going to save and improve the quality of life, extend their years of being physically active. The benefits for children and being more prepared to study when they go to school are phenomenal. However, in Texas right now, the environment is particularly receptive to the economic arguments. And so that's what I'm going to address right now. That there's benefits for individuals being able to say if people feel safe, then they're more likely to use active transportation, biking or walking. And of course, tying it in with transit, so that first mile and last mile. And a lot of innovative systems are coming out there. In Texas already, there's 4 bike sharing programs that have already are absolutely going to start, where it's kind of like the community rental bikes. San Antonio's been going for a while, and Houston and Fort Worth have launched. Austin will be launching this year. And those, especially if they're combined with facilities that make people feel safe to use them, are very promising. In D.C., there have been over 1 million trips, I think, in the last couple of years with their bike sharing program. But the other benefits, the economic benefits, are fairly amazing. And I'll go through some examples of that. But whether it's increase in property values or increase in retail traffic, therefore retail sales taxes, the net benefits are phenomenal that seem to easily outweigh the cost in most instances for the cost of actually retrofitting a street to be complete. Then in the rural, rural areas, a lot of times bicycling is an example of a non-ag source of rural income. So sometimes it's a mountain bike ranch. But there's a city in Texas, Copper's Cove, that has really applied themselves. They had nice wide shoulders, which used to be a rarity in Texas when we were founded in 1991. Now shoulders are common, and that was the fight of our first couple of decades, I think, in rural areas, was just to have shoulders. And while there's plenty of Texas roads don't have shoulders, it's pretty well universally understood that shoulders benefit everyone now. But Copper's Cove has taken advantage of those, identified great routes, and now their hotel rooms have shot up. They've even built new hotels there because of the bicycle tourism traffic. And then as in the urban areas, of course, it's that great benefits for retailers. That here's the web page for the Copper's Cove. They sell it as Bike Central Texas, and I urge you to visit it. And it's a beautiful town. Who would have thought? That we have such an incredibly inviting area. I've had people that have gone there say that it was like biking in rural France, but they got to do it without leaving Texas. And the benefits are, you know, broadly spread. So it's not just for the, we as individuals and what it does for the quality of life. It also is going to attract the kind of creative class workers that every company we hear of wants to associate with. And so big companies are frequently looking, like Google did when they were deciding to expand in Austin. They wanted to know, what about the bicycle facilities? Are the employees that we hope to hire in the future are going to demand those sort of things? And so that makes Austin competitive with San Jose or the Research Triangle or Boston. That Fort Worth, we don't think of Fort Worth as a bicycle mecca, but it's on its way. But one example of, by putting in a bike lane and accommodating bike parking and basically swinging open the welcome mat for bike and pedestrian and more, increased retail sales on Magnolia Street by 160%. So that makes the city happy, and it more than paid for the cost of the improvements. Here's another example. It's one of my favorite. When the city leaders decided to improve the street in West Palm Beach in Florida, it was so appealing to a developer that they invested $1 billion in new buildings and improving the rest of the environment. So one step can lead to another, and this is a particularly good example. In New York, they have taken it to a whole new level, and quite a bit of pride is New York and Chicago are battling to see who can be the best for bicycling. Of course, New York is famous, as is Chicago, for their pedestrian environment and their great transit systems. But now bicycling has gotten very serious. The crazy bike messengers in New York really were a problem and can be challenging for the pedestrians and for the motorists that are there. But now by channelizing and really engineering for all road users. They're finding that traffic fatalities are dramatically decreasing and more people are going out. So what's called mode share is increasing. Here's an example in Australia. There have been a few places that did not have a cycling culture at all, but when they put in complete networks, so it's not just an isolated part of a bike lane over here and a few blocks away or across town there's another few blocks of a bike lane, that where they've done systematic networks, they've seen dramatic increases. Here's an example in Australia. In Seville, Spain, they had a 10-fold increase in 3 years. It went from 6,000 bicyclists a day to 60,000 bicyclists a day by putting in this protected bikeway network, which again is part of a complete street system. Here's another great example in Memphis. We love to get examples from the South, and Australians kind of think of themselves as the Texas of the Southern Hemisphere, or they think of us as the Australia of the Northern Hemisphere. I'm not sure, but it's another good example of not a place that had a strong bicycle culture like we might think of Denmark or Amsterdam. North Carolina, another not exactly a hotbed of radical activities, has found that they get $340 million in annual economic benefits of just the greenways, not counting just the street network. And they've also found that just the bicycle tourism traffic in the Outer Banks is about $300 million. And I may be wrong about that. I'm quoting that off the top of my head, so don't hold me to that. But they did do a study on the overall bicycle benefits in the Outer Banks of North Carolina, and I could find that study if somebody's interested. I may be off on the amount. And so it costs less for individuals, costs less for businesses, and costs less for government. So what could be better? This gives an example of what 30 million bucks will buy. And as they say, 30 million and 30 million and 30 million, pretty soon it's some real money, to paraphrase. I think it might have been one of the former speakers from Texas. This is 1 mile of road, street widening for 30 million bucks in Tulsa. In New York, that'll get you that same 30 million, 20 miles of physically separated cycle tracks. Cycle track is one of the names, the most common name for protected bikeways. But we haven't, all the engineers haven't decided exactly what they're going to call them yet. But cycle tracks are a pretty specific term for that. Here's another example of 30 miles of high-quality off-road bike trails. In urban areas, typically an off-street multi-use pathway is about $1 million a mile. It can be a lot less in rural areas. And then here's an example of what's called a bicycle boulevard, where you kind of make it a little bit challenging but still accessible by cars, but not a through street. So many of our cities have been built with cul-de-sacs that actually create other traffic challenges and problems. And part of that idea is so that people won't speed through the neighborhood, so that the kids and the families can use those streets. Well, bike boulevards are a little bit like that, where it's really through and convenient for bikeways. And they've got a tremendous number of these in Portland, and that's very inexpensive to do. But something that really pays off, 100 miles of sidewalks for 30 million bucks, compared to a mile of a road widening. Then other things that add to a complete street, once you've got the bikes, you've got to be able to park them, and what's called a bike corral has really taken off. In Austin, they've already got about a dozen of these, but in Portland, they have about 90. And merchants request them and get in line to wait them. So there's quite a long waiting list in both Austin and Portland for more of these bike corrals. Businesses figured out that 10 customers are better than 1 customer. And studies have shown that bicyclists may spend less when they go to a business, and they have less capacity for carrying loads, but they go back more frequently. So over the course of a year, the local traffic actually pays off better for the merchant. So they found out that it's good business to have good bike parking as part of the complete street network. And then the cost of bike parking, dramatically cheaper. It can especially affect some universities. UT El Paso is trying to figure out how to go to a car-free campus, because the cost of parking is crazy. and they need some of that same land to build actual buildings and labs and other kind of facilities that will do more direct good than leaving cars all day. And it gives a lot of choices to people, so that if people can have the option of biking safely, then many people will choose that. And then Texas legislature, we have some big challenges in Texas. While we all know that there's a healthcare crisis and obesity epidemic, and we're trying to figure out what do we do with Medicaid expansion and how are we going to address the public health, well, Complete Streets is obviously a piece of that solution. One of the first things we can do is cut down the need for healthcare expenditures. And the built environment is an important way to do it. And we've done this. Bike Texas is part of a large coalition that includes referred to as the Partnership for a Healthy Texas, the Texas Pediatric Society, Texans Care for Children, Texas Medical Association, AARP, and many, many other groups that all understand the value of the built environment. It's nearly overwhelming. However, it's still a big challenge in the current legislature. There's fears that somehow that might cost something, even if the net benefit is higher. It's hard to get that message through. That it seems to be that at the city council level in urban areas, they're really beginning to get this a lot quicker. So we've got a number of local Complete Streets policies, more than were reflected in that study that Dr. Cole just showed us. In Texas, we've got city policies in San Antonio and Austin and Denton and El Paso, and we've got regional metropolitan planning organization policies in North Texas Council of Governments and in Austin Capital Area Metropolitan Planning Organization and others. So Complete Streets policies are spreading at the local level. Big challenges at the legislature. These are some of the groups that are supporting, and these are the specific bill numbers. HB 1102 has been heard in the Transportation Committee, and while we believe we have a majority of votes, that doesn't always get the vote. And so we've had some challenges to get everybody to agree. And then we are late in the session, so it's going to take something near a miracle to get this through this time. It's clear that we need to do more education and build our networks even stronger so that legislators are really hearing from their own constituents. And while this is really common for the urban legislators, a lot of the rural and small town legislators, they haven't seen the benefit for them yet, and a lot of their constituents aren't communicating that to them just yet. The authors, though, very bipartisan, and some of the strong conservatives and liberals and moderates are all supporting Complete Streets. And this has been a very important part of a strategy for getting Complete Streets in the long run.
Well, thank you guys so much for this presentation. We're going to open up now for questions. And you can type your questions into the chat box, which you can access if you take your mouse and go to the top of your screen. You should see a little green box. And then you can click on the chat box there and then type your questions in if you have them. Make sure you select send to all participants so that we can see what everyone's asking. But otherwise, I haven't seen anything pop in yet. But Dr. Cole, do you have any questions or anything for Robin?
Robin, I found it really interesting. You always talk about, or at least I try to talk about overcoming barriers and so forth to getting policy change. In your mind, what's the biggest, most important barrier? I mean, not just for Complete Streets. I understand it's an evolution where you may start with a sidewalk and then move forward, and you don't magically sprinkle dust and pixie dust, and all of a sudden a wonderful shaded street with protected bikeways and so forth goes on for miles and miles. But what's the biggest barrier to getting started down this evolution in a municipality? A lot of people will say, "Oh, it costs too much," and you presented very good evidence that it doesn't cost. In fact, it may pay off more in the long term than not. So, what, in your experience, kind of working with this, what's the biggest barrier?
Well, there's a cultural barrier. A lot of the leaders in transportation got there and got to their the top positions because they were good at building very large roads or very big budget bridges. And this stuff costs a lot less. So someday we hope to see that bicycle coordinator at the local or regional or state level is the pathway to real success and to leadership. So we do have some generational changes that we're looking at. We're finding that younger engineers are a lot more receptive to this. But the one of the biggest challenges that we have right now in the legislature is that the nature of redistricting. That we've had so many of the districts are so protected that you're either only going to elect a Republican or only going to elect a Democrat. And the Republicans right now are all in fear of a primary challenge to their right. So there is a lot of fear and misinformation out there about the UN Agenda 21, which is a sustainability agenda that the UN drafted. The U.S. was behind it back in 91 or 92. And yet that's actually putting a lot of fear as people are saying that the UN is trying to force this kind of stuff, smart growth and complete streets and bicycles are on everybody, and that they're going to take away our cars, I guess, along with our ammo. So that's actually a legitimate concern, and not just in Texas, but in all the red states.
We've got a couple of questions here, Robin, that you are expert on. First of all, from Julia, what is the status of House Bill 1102? Is it out of committee, and what about the Senate bill? Where are we with that bill?
Well, HB 1102 is stuck in the House committee, and by our count, we have enough votes to get it out. So it's just going to be a matter of whether or not it actually gets the vote. Unfortunately, though, the Senate bill has not moved. The Senate chairman, Robert Nichols, is from Nacogdoches, and he's in a lot of rural areas. And from his point of view, he doesn't think there's many bicyclists in his district, and so he really is not supporting it. So we have not been able to get a hearing in the Senate committee, even though we have what we believe are a majority of the votes. And in the House, we may get it out of there, but we're not sure that it's going to do much. Again, there's a lot of fear and concern. We've given information that shows over 500 communities have complete streets policies in the U.S. from local, and probably about 18 or 19 states have complete streets policies, and yet this isn't quite enough evidence for the current legislature.
So, and for a reminder for people listening, the bill 1102 is considering specifically complete streets legislation?
Yeah, HB 1102, House Bill 1102, as the lead author is Linda Harper Brown, a real transportation leader, Republican out of Irving, and we also have Rep. Jim Keffer, who's a leader of the Rural Caucus, one of the leaders, and also Representative Jeannie Morrison from Victoria, Texas, a small town. And this should have been a dream coalition in addition to a number of Democrats have signed on from all parts of the state. And it's an incredible geographic spread and party spread in the Senate as well. Yet that, along with the supporters of all the different groups that we listed before, hasn't quite been enough to get these things moving. So it's clear that we need to have more voices in each of these key legislative districts, like, for example, Robert Nichols, talking to their senators and their reps. So if you happen to live in Senator Robert Nichols' district, then give him a call and tell him you want a hearing. But also you can join at biketexas.org. You can get on our free email list and stay informed about these activities if you have an interest to engage in the legislative process.
Another kind of interesting question there that I think has come up that from a public health standpoint we always kind of deal with is complete streets are probably great for the people that they affect, and the change locally may actually result in an unintended consequence in other parts of the system. For example, as Eileen points out, build a complete street, you have economic benefit, increasing the property values there, but all of a sudden people who used to live there, let's say like on the east side of Austin, can no longer afford that, and the changing neighborhoods, they need to move out a little bit further to rural areas where it's harder to get bike or walking or active transport, so forth. So the net benefit to the population may be the same. In other words, people who might have been more active taking public transport, so forth, by walking the last mile or the first mile, all of a sudden have to commute more using inactive commuting. And you have a comment really about
Yeah,
that?
that's a legitimate fear, although it's mostly unfounded. That for every mile you live closer to the work, and typically a downtown area, you can pay an extra $10,000 for the house and come out ahead. That if you have complete streets and you can give up that second car within a family, or you can tie it into transit better, then we shouldn't just think about affordable housing. We need to think about affordable living. And transportation is one of the biggest costs that impacts a family's budget. And if you can take a big bite out of that transportation budget, then you can spend your money on a house that will really provide some family equity in the long run, and your family will be wealthier for it.
So again, thinking system-wide rather than the static thing where these people will just have to move out to someplace else, but they actually may change the life rather than just the commute kind of a thing. Yeah.
Right, not to mention their health benefits and the longevity and their chance to be active longer and remain in their homes, which is one reason why AARP is taking this on at the national level and at every state level, and they're one of our greatest partners in Texas working on this, is because if healthy seniors can stay in their homes longer and save tremendously on health care. So that's another advantage. And one of the costs, as far as gentrification goes, really has to do with proximity. So it's not necessarily whether or not there's a protected bikeway nearby, but how close are they to downtown? Because remember that a lot of the people that are the wealthiest, they can afford to drive a car and they can take their Beamer a mile away to get to work. But these facilities actually may be a way to help the rest of us that aren't that wealthy stay in our homes, even as property values go up.
So that may be a red herring, in other words. One final question we have here. With respect to HB 1102 and SB 565, these bills would not appropriate funding for the local authorities required to implement the policy. So it's an unfunded mandate is it an unfunded mandate? And if it is, how do we convince the committee legislators to actually put some money where the mouth is, in other words?
Well, I don't know if this was a setup to make it so easy for me to knock this one down, but in fact, there is no fiscal note and there is no unfunded mandate on locals. The HB 1102 and SB 565, they're only required to be considered if there is federal or state funding involved with those cities. So if they're using their own local funds and they're not using any state or federal funding, they don't even have to consider complete streets. However, under the bill that has really worked out with a lot of input from legislators last session, and where it did get out of both the House and Senate Transportation Committees, was that there's a relatively easy opt-out, but somebody has to go on the record and put their name on the line. So that project director might be able to opt out, but they've got to actually point to actual facts and have some public information available as to why they did that and put their name on the line. So they can't just do it without a reason. And so we wanted people to have a lot of flexibility in how to do that, but that was a great question, and thank you for asking.
Okay, and with that, we're going to go ahead and wrap up here. I just want to thank our guests again for joining us today, and we hope you enjoyed it. This webinar will be archived and put up on our website, www.msdcenter.org. You can also check out our website for information about other bills that are in the legislature that are related to child health, and also find out info about our other upcoming webinars. So I hope you join us in the future, and thanks again for attending today.